Stakeholders in the health sector have emphasized the urgent need for the implementation of a mandatory health insurance system that covers the entire population. The Director General, National Health Insurance Authority, Mohammed Sambo, said efforts are at the final stage in the coming up with NHIA operational guidelines towards full implementation. The call for a mandatory health insurance system comes in light of the challenges faced by many Nigerians in accessing quality health care due to financial limitations. Benedict Oko has more on the story.
In a significant move towards enhancing healthcare accessibility and affordability, a committee on mandatory health insurance was established to develop operational guidelines for Nigeria's Health Insurance Act. Despite these efforts, stakeholders and experts in the health sector are urging for the full implementation of a mandatory health insurance system in the country. Speaking at the Health Financing Policy Dialogue held in Abuja, the Director General National Health Insurance Authority, Mohammed Sambo, provided insight into the work of the Mandatory Health Insurance Committee and the progress made in the implementation process.
The mandatory social insurance, their work does not entail rigorous analysis. They have almost completed their own, but their work has a lot of implications, so that in trying to implement the mandatory law, what are the various things that you need to consider? I mentioned about 3 committees on the guideline, because the guideline has to be aligned with the new law. And I mentioned the fact that they have concluded their assignment, and the final draft is on my table. We are just trying to push it to the Honorable Minister for final approval. Within a few weeks from now, they should be able to conclude their work, because they have reached advanced stage. So if we are able to get them before this government will leave, we will seek to present them before the Federal Executive Council for approval. If we are unable to conclude before this government, it will be a low-hanging fruit for the new government that is coming.
The Budget Office of the Federation, Ben Akabueze, stressed the need to allocate adequate funds to support the implementation of the Health Insurance Act.
If we focused on things like the BHCPF, you can achieve greater predictability in the funding of the sector. If we wanted to make it difficult for them to access those funds, we'll simply pull out the rule book. The rule book says at the end of the fiscal period, if you didn't utilize the funds, it goes back to Treasury. So the fact that there's a willingness to warehouse those funds and wait for the health to be ready to utilize them shows that nobody is trying to stand in the way of the sector. And so if there are challenges with utilizing the funds, I think the sector needs to look internally.
The Managing Director, Nigerian Health Watch, Vivian Ihewazu, called for increased awareness and sensitization campaigns to promote the adoption of mandatory health insurance to ensure widespread understanding of the benefits of health insurance.
The new Act really is a game changer. First of all, health insurance is now mandatory. But second of all, what it now includes is the Vulnerable Group Fund, which will now ensure that people who are low income, the most vulnerable, we have people here from the Deaf Society who are mentioning also that they have not been carried along. These other groups will also now, should also now have access to health insurance. We know that our health budget also has not met up to the 15% of the budget declaration. So in general, access to health financing has been a problem for the country. So some of the discussions today at the Nigeria Health Watch Health Financing Dialogue is how can we find those more innovative financing mechanisms?
The urgent push for a mandatory health insurance system stems from the belief that it will serve as a crucial mechanism to bridge the gap in healthcare accessibility, particularly for the vulnerable populations.